Hi, this is Richard Terrell from Benefit One. I just want to take a couple of minutes here to share an article that I just read and the impact that it might have on your company and how self-funding could possibly fit into this option for you. And actually, the article is in a business journal from Northern California, and what it says is that bills mandating coverage for mental and other illnesses passed the Assembly. Basically, it says in California, 2 recently passed state assembly bills will require private health insurers to cover the diagnosis and treatment of mental illness and developmental disorders such as autism. Now, I'm not speaking about whether or not these conditions should be covered or whether you want to cover them. What I am speaking to is the fact that the state of California mandates that every insurance program does cover them. And it is one of, I think, 45 or 46 mandates at this point that every insurance company has to have, and therefore they build that into the premium that they charge you when you have an insurance program. However, a little later on in this article, it also says, yet the bills could prove to be unnecessary or even premature as federal health care reform takes shape over the next few years. The Affordable Care Act, that's the Obamacare, right? Calls for individual states to determine essential health benefits, which will help shape the benchmark for plans offered through state-run health exchanges come 2014. States will have a fair bit of latitude in determining what counts as essential, and California could easily include mental health and substance abuse conditions that are similar to the two new laws, making them redundant and potentially costly. I'm feeling that what's going to end up happening here is that California, since we already have mandates in California, that they're going to include those mandates in the affordable programs or in their exchange programs that small groups are going to be able to choose from. The issue here is that if you have a self-funded program, you are not liable for state mandates. You are only liable for those that are specifically dictated by ERISA, which is under federal law. Things like maternity and some of the other areas, not nearly to the degree that California has. The point being that self-funding allows an employer to have a lot of latitude, a lot of freedom to create a program that makes sense for his employees, for his budget, for your ability to manage the payment of health care for your employees. So that's it. If you're interested and you want to get more deep into self-funding, go to our website, which is www.thebenefitone.com/self-funding.